Good morning and welcome to day 5 of Apprenticeship Week. And today we're going to focus on apprenticeship opportunities within the health sector. I'm delighted to be joined by colleagues from Mid and South NHS Foundation Trust to hear about some of the roles which don't necessarily spring to mind when considering a career in the NHS. My first guest is Khan Goodchild, who is the Work-Based Learning and Apprenticeship Advisor at Mid and South NHS. So Khan, could you start by telling us a little bit about the trust, please, and which hospitals it covers?
Certainly. So Mid and South Essex NHS Foundation Trust is an acute hospital service, and that means that we provide health and care services for people needing short-term treatment for severe injury or periods of illness, as well as urgent medical conditions or support for those recovering from surgery. We run 3 main hospitals, one at Basildon, one at Broomfield and one at Southend, in addition to providing services in smaller community hospitals in Braintree, Brentwood, Orsett and Malden. The trust employs around 16,000 people and it's currently one of the largest trusts in the UK.
Thank you very much. Thank you, Khan. So what sort of apprenticeship opportunities are there within the NHS, please, and what can these roles lead to?
The NHS is the UK's biggest employer, and we offer a huge variety of apprenticeships to both existing and new staff. Although we have colleagues on clinical apprenticeships, training to be nurses, therapists, radiographers and healthcare scientists, there are also many people on non-clinical courses. We have colleagues studying on apprenticeships as diverse as leadership and management, data and computer sciences, IT support services, accountancy, business administration and building maintenance. So the NHS really isn't just for doctors and nurses. In fact, you'll be hearing shortly from one of our data science apprentices to learn a little bit more about his learning journey. The NHS apprenticeships can help people gain the qualifications they need to enter a range of professions such as accountancy, allied health therapies, business administration, project management, leadership, cybersecurity, data analysis, IT technical support, nursing, pharmacy, procurement and logistics, as well as a range of skilled trades. We advertise some direct apprenticeship opportunities, but most apprenticeships start as an entry-level role in the trust before beginning a programme with us. And you can find full details about our vacancies and apprenticeship opportunities on the trust recruitment webpage.
Thank you, Khan. I must say, when we spoke last week, I was very, very surprised to hear about the range of opportunities you offer. And as you said, particularly the number of people working within IT and data, it's absolutely huge. So thank you very much indeed.
Now it's a question for Paul. Paul is a theatre and digital intelligence manager working with Mid and South Essex NHS Foundation Trust. Paul, can you tell us a bit more about the role and how the apprenticeship programme has helped you to develop your skills?
Thank you, Peter. So my apprenticeship journey has been a massive eye-opener, primarily because I originally come from a clinical background. So I trained and qualified as an operating department practitioner back in 1996. And from that point up until about 2017, I was 100% clinical. My role changed slightly just before the pandemic, and I became almost like the system administrator for our electronic patient record system that we use within theatre, and that produces a massive amount of data on a daily basis, and we look at a whole range of different parameters to do with booking patients, list utilization, into the future, and retrospective looks as well. Previous to the role that I'm now in, I had very little advanced knowledge of tools such as Excel. And it was only when I saw the apprenticeship, the data apprenticeship being advertised, I thought, hold on a minute, this might be a good idea. And going through the journey and the process of learning these new skills, which would only have been available through this particular apprenticeship, I have been able to transform my daily working, my reporting, for not only for me but for my colleagues, directors of nursing, etc., etc. The list just goes on.
Excellent. So how do you use data on a day-to-day basis in your role as a theatre intelligence manager?
Well, we're primarily using the data to look and seek opportunities to better utilise lists in the future, and learn from past experiences with lists that have not gone to plan or have been underutilised. See, the NHS is under a massive strain to reach targets and deliver care in as timely manner as we can possibly do, and that can only be achieved if we maximise the utilisation of our lists, and that all comes down to data. So if you can't analyse the data, it's a slippery slope. You can't do anything with it.
Yeah, and data's an interesting field. So next question is quite nice. What do you actually enjoy most about your role?
What I think I enjoy the most is taking the data and being able to visualize patient journeys. I think because I come from a clinical background, when I see patient into anaesthetic room, patient sent for, and all of these timestamps that I myself inputted into the system for over 20 years, I can now apply that to a completely different field of non-clinical skills and try to make patient journeys better and utilize the time that we have available in terms of operating lists.
So that sounds like a lot of work, but what hours do you work and how do you balance the training in the role as well?
Sure. So I'm 37.5 hour week, so I'm full time. Because we're a big trust and we're on different sites, as Khan alluded to earlier on, I do spend a period of my time on some of the other sites. My base site is Broomfield, but because of my role, it enables me to partly work remotely as well. So it's a real mix, and it's really down to what the service requires at that time.
Time as well. What is the one thing you wish somebody had told you prior to starting your apprenticeship?
That's an excellent question, and I think for me it would be make sure that you set enough time aside in your daily week, in your calendar, and there are different tools available to do that that I won't bore you with. But time, I think, and be realistic about how long certain things will take.
So yeah, it's very important, time management. Thank you very much, Paul. I'll now hand back to Fiona.
Thank you, Paul. Thank you, Peter. So I'm now going to introduce Adaronke, who is an apprentice occupational therapist within the Trust. Adaronke, thank you for joining us today. Could you just start by explaining what an occupational therapist does, please? And how does that role fit in with the rest of the hospital-based team?
Thank you very much, Fiona. An occupational therapist helps people understand where they are with their difficulties as a result of whatever matter have gotten them there, and of course to help them to recognize where they are coming from in their life and support them to get to wherever they choose to get to within their ability. We basically support people to overcome all kinds of challenges so that they can live as fully and independently as they possibly can and not just exist. We don't want people to just exist. We want them to live their life to the fullest and enjoy it. And this can involve teaching them new ways to do things or making changes to their environment to make things easier for them. And we fit into the MDT when other health professionals have done everything. The patient's personality are mostly left unattended to. So they've done all that medicine can allow them to, but the opportunity for the patient to thrive remains. Hence, an occupational therapist will step in to review the total person of that patient and fix the missing link to make the patient whole again. So an occupational therapist is the last practitioner that sees a patient before discharging the patient to the best destination the patient will prefer or that will be appropriate for the patient to go to, if I can put it that way. Yes.
And do you continue to work with the patients once they've actually been discharged? Is it an ongoing relationship you have with those patients, or
Yes,
would they then be supported by someone in the community?
Yes, so we have some other team in the community team. So occupational therapists work in diverse locations in every setting, possibly in the acute setting, in the mental health setting, in the community, in the residential home, and in the comfort of people's houses, even in prisons and all of that. So once we discharge them acutely and certify them they can go home, we see that the community occupational therapists pick them up from there. We will discharge them through the rehabilitation team. It could be discharge to assess team who are going to work with them again for another 6 weeks and see how they're coping and see how they can fully, transition to their level of independence.
So once you qualify, then you can either work in a hospital or in the community. There's the option.
I can work as a public health educator, practitioner, promoting awareness of different illnesses. I can work in prison. I can work in the community. I can work with children as a pediatrician, occupational therapist. The list is endless. It depends on what you find, appealing to you.
Yes.
So
Yes.
I can work with local authority. I can work in council anywhere, really. And I can stand on my own as a consultant.
Opens up lots of opportunities, and I believe, don't they, that some businesses invite occupational therapists in to talk about the workplace and make sure people are working in the most appropriate way and they've got the most appropriate equipment. Is that right?
Yes, it's part of what we do. We provide people with equipment. At the last resort, we always want people to do their very best, but we can help them also with package of care and with equipment to assist them to be able to live the best of their lives.
Thank you.
So we call it adaptation.
Okay, so in terms of the entry requirements to become an occupational therapist, what are they, please? What are the minimum entry requirements?
I'd like to quickly say that occupational, as an apprentice, I do an integrated work-based learning where university theories are implemented into work, and as you progress, you continue to practice with less supervision to work at the level that you have learned and you have evidence at work. So that's very important for everybody to understand that. So now going into the entry requirements, if you're coming in as an apprentice, don't forget it's very important to have at least 2 to 3 or 3 A-level qualification, 5 GCSE, grades 9 to 4 or 8 to 6, including science, and a BTech, HND or NNC, including biological sciences, a relevant NVQ, a science-based access course, equivalent Scottish or Irish qualification, depending on what you have.
Because and when you're applying qualification.
Yes, you're applying for an occupational therapy degree course.
Yes. And how long is the training, Aderonke?
So as an apprentice, because you're working and then you're going to school, which takes away the burden of payment off you. The tuitions are paid by the government and your employer, is 4-year course. But if you're going directly from college straight to traditional university setting, it's a 3-year course, and your master's is 2 years.
But this way you're coming out with the work experience, having worked for the trust for 4 years and your degree. And as you said on the phone the other day when we spoke, that it actually, the off-the-job training supports you, enables you to do the on-the-job work.
Oh, the support is enormous.
Yes.
The support is fantastic. You get the support all round. All round support is available for you. And of course, I will not end without mentioning that apart from academic qualification, you still need to be a natural people person who is able to make anyone feel quickly at ease, creativity, and of course, ability to balance patience with enthusiasm is also needed. So you will need to enjoy teamwork and be able to think quickly on your feet too, just
Thank
to
you.
give a shout out on that.
Thank you. I've just got one final question. Just if you could just explain to us, what does a typical day look like for an occupational therapist, please?
Thank you very much. Working as an occupational therapist, your role will include to support, to adapt to life after major surgery, people with mental illnesses or learning disability with everyday activities such as going to work or volunteering. You want to prepare them to have the I can do ability to face it again. Elderly people stay in their own homes by providing adaptations for them, such as level access shower, or stair lifts, ramp, and all of that. And of course, let me mention also that advising on how to approach a task differently using equipment or assisting technology that I've mentioned before, adapting the living or working environment, finding strategies to meet your patient's goal are all part of what we do. As well as working with individual patients, we work with family, and we could also work with groups or as part of a multidisciplinary team in the hospital, clinic, charity, prisons, social services department, whatnot. So it depends on the role that you have taken on.
Yes. Yes.
That would define the work you're going to be doing, basically, if I put it that way.
But an incredibly varied role, working with colleagues right across the trust then.
Yes, we work with colleagues because,
Yeah.
again, you remember when we talk about referring our patients, maybe a patient comes to me that has a challenge in a particular role to be able to fulfill his daily activity. We call it ADL. We look at what other components, because we look at this patient totally as an holistic person, and then we'll see what other components is not within our role that we need other practitioners to meet. And so we invite them over to assess this patient. So we work across all the team
As a big
in
team.
providing, as a big team in providing care to our patients.
Well, thank you so much. Thank you to all of you who have joined us today. The information you've given us has been absolutely fantastic, and I think with Peter and I, we've certainly learned an awful lot from you. The Mid and South Essex have a health and care academy, which is an absolutely brilliant opportunity for anybody who is interested in finding out more about careers within the NHS. They run masterclasses, speed careers events, and even offering work experience placements as well. Now, I think it's fair to say the work placements are very, very competitive to apply for, and there are certain dates within the year for which you can apply. So on your screen now, you'll be seeing an email address, contact details for the Mid and South NHS Foundation Trust. Please reach out to them if you'd like more information on careers within the sector. And if you have any questions generally about apprenticeships, if you contact us at apprenticeship.hub@essex.gov.uk. Thank you all for listening and for attending all of our broadcasts this week. Bye-bye.